Public Health England's communications function is appalling, and they really are coming at this in a narrow way. The sciences are not just medical and biological sciences. The sciences include behavioural science and social science, how we live our lives.
And how much of it have you seen?
Of what?
Of the science that they're drawing upon for these advice.
Well, I haven't seen any of it published. I mean, they've just...
Would you expect to?
Well, yes. I mean,
because this is... forgive me for being a layman, but I woke up this morning and that was the first thing. I was trying to work out why I felt so discombobulated. Because normally I lean to experts, and most of us do. It's healthy, Brexit notwithstanding. But I suddenly realised what the problem was. I haven't seen their workings. They've shown me the result. They've shown me their conclusion, but they haven't shown us how they got there. And I'm slightly dismayed to hear you, I think, endorsing that fear.
I absolutely do. And in a period of 3 months, we've gone from Michael Gove saying we're fed up of experts to a position where we're saying these are the experts, you've got to do what they say. And actually, you need a good dose of common sense in with what the experts say as well, and lived experience of the public on the ground. The audience at Newsnight last night were almost completely question time, almost completely sceptical of the minister. I mean, the problem is, the government's lost trust, and that's a disaster. You need trust when you're in a situation like this. They haven't got trust because they feel as though they've been kept in the dark.
And if you had been in... I want to spring to the defence of Chris Whitty and Patrick Vallence's perceived probity. They wouldn't be consciously party to any dodgy conduct, would they?
No, but I feel as though they're being set up.
Do you?
To take the blame for this. I think Boris Johnson, there he is, flanked by his 2 scientific advisors. They will have the parameters with which government is prepared to work. They've already, they're 10 lengths behind in the boat race, and they're going to be the ones who get the flack for this. But they also, though, I mean, I have to say, they should get some other types of scientific and evidence into the conversation. I mean, we knew in the Ebola outbreak in 2014 that we lost 3 or 4 months because there was no social science there. The boys and girls in the labs went in there, did a good job. They identified the virus, they set up labs and all the rest of it. And when they discovered that one of the problems was the intimate body washing of the dead, they thought that they could sort it by just telling the village chiefs what to do. And actually, it was only when the anthropologists got involved in the July, after the thing started at the Easter, that they discovered, goodness me, that the people who you had to talk to about body washing rituals were the women in the women's committees.
Oh, God.
And
yes.
they'd assumed you just tell the boys and they make it happen.
What an illuminating definition. Yeah. But it's obviously, again, dispiriting. So if you were in charge now, what would you be doing differently from Chris Whitty and Patrick Vallance?
I would get a good dose of community organisation into the equation about what should be happening. I would make sure that all the data they've got is being made freely available across the country so people can see whether their village, their town, their region has a problem, and they can intervene, make those decisions locally and own those decisions about whether you close a school or not. Because this isn't about closing all schools. Some will need to close. And that they really need to empower local people to take charge of this, because local people are going to have to pick up the pieces. And they're not as prepared as they could have been if the government had spent the last 6 weeks with the community side of this on the same page as the science side.
Again, I'm always slightly wary of asking scientists to stray into speculation, but why would... you mentioned the nanny state as perhaps being one of the influencers of government thought or government conduct, but why would they not have done all the things you've just described? I
don't know. It's a mystery to me. I mean, I think it may be limitation of our scientific training in this country. It's something I've written about over the years. Yes. In this country, you choose between arts and science at 16. So we have a scientific community that's not studied philosophy, not studied the humanities.
Yes.
and vice versa. We have, most journalists haven't studied science, so we have a mismeeting of minds, if you will, about the reporting. We don't have holistically trained people. Like in France, everyone studies a bit of philosophy in school and thinks wider than just their tram lines.
The why, not the what, isn't it? As it so often is in areas of power. Final question, possibly one you can't or won't answer. What does the light at the end of the tunnel look like?
We'll come through this. There'll be an attrition. There may be excess deaths, 100,000 or more. The economy will bounce back probably vigorously because, they play the markets as well in this situation. People will have been selling to buy cheap and, that'll all go on. But we don't know how long it'll last. I mean, the post-First World War one went on for more or less 2 years, and it came in waves, which is the other trick that nature has up its sleeve for us. You think it's over and then it comes back again. So we've got to maintain vigilance. But the positive side of this is it's an opportunity to rethink the way we live, to do less journeys to work more at home. All this money that the universities have been borrowing to build buildings is going to seem really rather silly when we have a big move towards home-based, computer-based learning. And, people don't...
Yes, I mean, you'll understand that I know you appreciate Professor Dr. John Ashton, that feels a long way off, albeit that it does paint a positive picture